Hey everyone, it's Nurse Dani coming to you live on Intermountain Moms, and I have Dr. McBride with me today from Northern Utah Pediatrics. And I've been wanting to do a live stream with a pediatrician for a while now, because a lot of the questions that we get are about newborns and questions like teething and when should I take my baby to the doctor, and sleep training, and a few others that we're going to get to today. So before we dive right in, Dr. McBride, tell everyone a little bit about yourself.
Sure. So I'm a local boy, grew up in Syracuse. I went to Syracuse Elementary, Clearfield High, Weber State, and then I went out east for my training and have been back home now for 3 years.
And you have personal experience because you have children too?
Yes, yeah. I have 4 children, 2 older ones in elementary school, so 9 and 7, and then 2 younger rambunctious boys, age 2 and age 1.
So the advice that you're giving today is not only professional, but it's tried and true at home.
True, yes. Yep.
Okay, so probably one of the most commonly asked questions these days, and me, even myself, being a nurse and a mom, it's really concerning when your kids get sick, especially if they're small babies and infants. Let's start with when to take your baby to the doctor. So it's cold season, it's flu season, RSV. What should parents be looking for, and when should they go to the doctor?
Well, a lot of it depends on the age of the baby. So if your child is less than 3 months old,
like we're talking like 3 months, 0 days and younger, or in any time during the 3-month stage. Yeah. I mean, from birth up until they turn 3 months, there's a little bit, it starts turning gray area between age 2 months and 3 months. So you might as well make that cutoff at 3 months. Anything less than 3 months, we are a lot more cautious. So anytime there's a fever, we treat that as a emergency. So and define fever.
So anything greater than 100.3.
100.3 degrees Fahrenheit.
Yes.
And how should parents be taking a baby's temperature?
So it's okay to start by maybe doing a forehead temperature or an ear temperature or an armpit temperature. If any of those are close to being high or are high, then you should always confirm it with a rectal temperature. Whenever I recommend that to patients, I see a little bit of fear across their face when they hear rectal temperature, and I think a lot of parents are worried that that could hurt their baby. But if you look at those little thermometers, just the very tip of it is metal, and that's all that has to go into the baby's rectum. And I recommend just taking that tip and dipping it into some Vaseline, and then that's all that has to go into the rectum. And it doesn't hurt them. They will squirm and grunt a little bit.
Be a little uncomfortable.
Yeah, but they're, to them it'll feel like they need to have a bowel movement, and so they'll just try to push it out.
And the information that you can gain from finding out what their temperature is really important. So
yes,
it's worth doing.
It's worth it, yes.
So a temperature of 100.3 degrees or higher in a baby that's 3 months or younger. And what else are you looking for? Let's talk about fevers for older babies too, while we're on that topic.
Yeah. So during the first year, I make that 100.3 or higher the cutoff. So 12 months or younger, 100.3, call it a fever. Over a year, you can wait until it gets up to 101.4. These sound like random cutoffs. What 100.3 corresponds to is 38.0 Celsius. What 101.4 corresponds to is 38.5 Celsius. And those, in the world of medicine, we actually rely on Celsius. And so that's where all the studies have been done, is on Celsius. So 38.0, 38.5 correspond to 100.3 and 101.4 respectively.
That's good information.
So that's why doctors are coming up with these random numbers, is because of the Celsius scale.
And how long should you let the fever go on before you call the doctor in older babies?
So over 3 months, you can wait about 48 hours. Most viruses will give you a fever at the beginning of the infection.
And fevers aren't bad in and of themselves, right? I think that's important for people to understand. That's part of your body's mechanism of fighting the bacteria or virus or infection. And so can a fever be too high? Does the actual temperature concern a doctor just as much as what might be the underlying cause? Not
really. The height of the fever can give us an idea of what's causing it, but that's about it in terms of what it does for us. The fever is being caused by the child's body, not by the infection itself. So I like to think of it as a thermostat. When your house gets cold, you walk to the thermostat and you turn it up. So you're in control. And once the temperature in the house gets to where you've set the thermostat, the heater turns off. The body does the same thing. When it has an infection, it turns up the thermostat, and once it reaches to the point that it wants to be, it stops climbing. So there aren't many infections. In fact, there's almost no infections out there that will cause a fever to go too high or a temperature to go too high.
So even like I've had a lot of friends lately with kids that are like at 104, 105. My niece had a temperature of 105 yesterday. Parents don't need to be afraid of that.
No, 105 is okay. 105 is safe. High temperatures that cause problems are 107 or higher. And the only time you can get a temperature that high is if you're in the desert in the summer, in a hot car in the summer, or you can have a funny reaction to anesthesia.
But your body won't create that.
That's all caused by some outside force. Whereas all these fevers are driven by your body, and your body won't purposely cause anything that is dangerous.
So you can let it go on for 2 days in a baby that's older than 3 months. Yep. And does that rule change once they're a year, or is it still a good rule of thumb? Call the doctor after 2 days.
Yeah, maybe a year or older you can go to 2 or 3 days.
Okay.
So the only caveat to all this is influenza. We're still right in the middle of flu season. It is starting to taper off. The reason I say there's a caveat to that is because there's a treatment for influenza. It's called Tamiflu. And that medicine is best or most effective if it is started within 48 hours of symptoms beginning. The one kind of thing there's a couple things that can tell you, hey, this might be flu.
Yeah, what's the difference between a cold and a flu? When do you know?
Like I said earlier, height of fever can give us an idea of what's causing it.
So is a higher fever more likely to be related to influenza?
Yeah, so influenza, not to be confused with a stomach bug or what.
Yeah, a lot of people think flu means like stomach bug, but influenza is a respiratory virus.
Yes, exactly. Yeah. And so stomach, we call it stomach flu. I grew up, my mom saying, "Go, you've got the flu," but that's not influenza. Influenza is a respiratory virus. Even that wording can be kind of confusing because it causes a mild cough. But we say respiratory illness because that's where it infects us. It goes to our lungs, and that's where it begins its effects. So
other than high fever, what else do you see with influenza?
Well, the high fever, and that high fever is usually your first symptom. So when you get a cold and you get a fever from the cold, you start with a runny nose, and then from there a sore throat, and there a cough, and then you get your fever. Whereas with flu, boom, that's your very first symptom, and it's high. It's 103 to 105. It will sap a person's energy significantly. So when people have flu, they just lay there and they sleep a lot. So if you see high fever, a child that has just plummeted in terms of their energy, that's a good sign it could be flu, especially if it's middle of flu season, that you've possibly been around somebody that's had flu. And so in that instance, it's a good idea to go to your doctor at the first sign. And they can test for influenza, and if it's influenza in a young child, that treatment, Tamiflu, is recommended.
Does that help to reduce the course and make the symptoms, you know, dampen them a little bit?
Tamiflu is not the silver bullet that antibiotics are for a bacterial infection.
Yeah.
So most parents will say, oh, my child who had an ear infection or pneumonia, within 24 hours, they turn the corner significantly.
So they're expecting the same outcome with Tamiflu. Yeah.
So it can happen in some patients. I've had some parents say, yeah, that made a big difference. But most cases, it doesn't help that quickly. But, you know, you can expect within 3 days, 4 days that they'll start to improve. Whereas if they weren't taking Tamiflu, you're looking at 5 to 7 days.
And you're totally miserable the whole time.
Yes.
So each day counts, especially when we're talking about little kids, because then they don't eat and they become dehydrated quickly. And that can be a huge problem related to colds, RSV, influenza, correct? So are hospitalizations related to flu and cold usually related to difficulty breathing and also dehydration?
Yes. So hospitalization secondary to any of those illnesses are usually due to some kind of complication.
Related to it, not that in and of itself.
Yes.
Yeah.
So flu itself usually doesn't cause many issues. The cold itself, RSV itself, they don't cause many problems. It's, in the case of flu, it's the secondary pneumonia or the secondary dehydration. In the case of RSV, secondary dehydration. In many cases, RSV can cause a drop in oxygen, and that's a common reason for admission. And same thing with a common cold. With a common cold, there are a much lower rate of complications requiring hospitalizations. So for that reason, that's why we call it the common cold. It's just a common everyday thing.
So if they don't have to be hospitalized because of it, then what are some of the best things that a parent can do to support their child through it?
Yeah, there aren't many medicines that they can give.
There is no treatment for it other than the Tamiflu if it's caught early, but other than that, we're just supporting them until it's gone.
Every other virus out there, there's no medicines that will cure the virus itself. But you can have a lot of faith in your immune system, in your child's immune system. I mean, if we think of the number of colds that we've experienced in our lifetime, it's hundreds. And every single one of those times, our immune system has handily killed off the virus. So you can rely on that. You know that your child's immune system is going to take care of it. So then it's just a waiting game, and it's trying to just help them feel comfortable throughout the process. No parent wants to just sit there and watch their child be uncomfortable and just say, sorry, you know. So in patients, I would say younger than 5, younger than 6 even, your only options are Tylenol and ibuprofen. And ibuprofen you can't give in a child less than 6 months. What those medicines are useful for is fever and discomfort. And in fact, I like to think of those medicines as used purely for discomfort. If the fever causes discomfort, go ahead and treat it. If the fever is not causing discomfort, as we've already discussed, a fever is not a dangerous thing. In fact, it's part of the body's defense mechanism. Right. Go ahead and let it ride out.
What about cool, like lukewarm baths and that kind of thing too? Do you recommend that?
If they make the child comfortable. So cold and cool baths, all that does is it keeps the heater on longer. So again, back to the analogy of turning up your thermostat. If you turned up your thermostat but opened all your windows, your heater would just keep running.
That's a perfect analogy. Yeah.
So in a child who's trying to generate a fever, whose body is trying to generate a fever, if all you did was try to put them in a cold bath, it would just make them shiver because their body's trying to generate.
It's definitely not going to make them more comfortable.
Yes. And so they would just be miserable looking at you like, Mom, why are you doing this to me?
Right.
So, a general bath, on the other hand, if that's going to make them feel better, go for it.
What about suctioning when a small baby has a hard time breathing at home? How do you manage that? Yeah,
so suctioning can be helpful, especially if it's interfering with their ability to sleep or feed. If if they're still feeding okay and sleeping okay, all of that noisiness and all of the runny nose tends to bother us more than it does them. So in those instances, go ahead and wipe it away. But you can cause irritation, you know, if you suction all the time. So what I tend to recommend is nasal saline, so saline drops or saline spray, not followed by suctioning, just the drops. 2 or 3 drops per nostril. The baby will hate it for a few seconds. And then everything, all the secretions will come pouring out.
Because it loosens it.
Yeah, it loosens it up. And they'll either swallow it down, which is okay, or it'll come out the front.
And just wipe it
and just wipe it away. RSV is one of those viruses that's particularly bad at causing nasal congestion. And so in those instances, a pediatrician or family medicine doctor will prescribe a suction machine. And so if the doctor feels that it's useful, then that's an instance where it would be good to do suctioning. But outside of that, I would reserve it for instances when it's interfering with feeding or sleeping.
And what are signs of respiratory distress in a baby? I feel like we have to cover those in case a parent sees that. When do they need to go to the hospital for that? Yeah,
so the signs of respiratory distress are subtle. So it's hard. You know, I spent 3 years in training learning
to recognize it.
To recognize that. So it is hard. So there's something to mother's intuition and just this mother's sixth sense. So if you as a mother feel that your child is having a hard time breathing, by all means, bring them in.
Way better to just check it out and be sent home with some peace of mind if everything's okay.
Yes.
Yeah.
On top of the sixth sense, it's good to watch a baby breathe without a shirt or a onesie on, and just watch their bare chest when they breathe. The first sign of a baby working hard to breathe is watching their belly. All of us breathe using our belly, our belly in and out as we breathe. But we all kind of have a sense of what that looks like when we're comfortably breathing. So if you look at a baby who's starting to have some hard time breathing, it tends to move just a lot more in and out, and it tends to kind of swing kind of forcefully in and out. And that can be kind of a sign that they're working hard to get air in and out. As respiratory distress progresses, it tends to kind of move upward. So it starts at the belly, and then you start to see just under the rib cage, you see that skin kind of getting tugged up under the rib cage with each breath. So belly's still moving, as we mentioned before, but now we've added the rib cage. And then as it moves further up, you then start to see the outline of the ribs with each breath.
Because it's sucking in.
Yes. Right? So you see 3 or 4 ribs with each breath. We all will do that on a big breath. So if it just happens once every 10 minutes, no big deal. But if it's every single breath, that can be concerning. So about the times that you see under the ribs or between the ribs, that's about the time that you bring them in to see us.
And what about nasal flaring? Will they start to do that too?
Yeah, so if you see nasal flaring, definitely, you come in right away. That's kind of one of the...
Or bluish, palish, purplish lips.
Yes.
Anything like that.
And with the lips, if it's where the lipstick goes, that's concerning. If it's where the mustache or beard is, that's a little less concerning. That's the same as our extremities becoming cool because we're a little cold. But definitely if you see any blueness of the actual lips where the lipstick goes, those are late signs. And so those are signs, if you happen to see that, maybe your child has progressed really rapidly in the 2 hours since you last checked on them. So again, the nasal flaring, the blueness of the lips, this little notch here at the base of the neck, if that's getting tugged in with each breath, those are late signs, and that often means an emergency. That means coming to an emergency department if it's middle of the night kind of thing.
Good advice. What about coughing? That's another common question that parents have. There's a cough usually associated with like the cold, RSV, not so much with the flu. Is that true? Can you cough with the flu?
You definitely cough with the flu, but it tends to not be the worst cough in the world, unless you're starting to develop some of those complications of flu, like pneumonia. But in the early signs with flu, it's a little bit of a cough. So like we were mentioning before, you know, it's high fever. And when I ask, what about runny nose? Thin runny nose. What about a cough? Yeah, a little bit. But those aren't the primary symptoms that you tend to see. Even though it is a respiratory infection, every other respiratory virus, on the other hand, you cough quite a bit. It tends to be one of the later symptoms. So you start with more of the upper airway involvement. So nose, throat, things like that. But then it will often move down into kind of what we call the larynx, which is the voice box, and the trachea, which is the air tube below the voice box that goes down into the main part of the lungs. Those are areas that are often affected by your common cold.
And so it's one of the last symptoms to disappear is your airway is healing after the infection's gone.
Yes.
So you may see them persistently cough, or how long is okay after a cold for them to keep coughing before you talk with the doctor?
Yeah, you can go up to 2 weeks. If the cough is kind of there, not really causing a whole lot of problems, but it's just still there.
Noticeable, but not affecting their ability to eat, sleep, that kind of thing.
Yeah, you're okay to watch it for 2 to 3 weeks. If, on the other hand, it seems to be worsening, if all of a sudden they're having fevers again, if it's waking them up from sleep, or if we're seeing difficulty breathing again, those are all signs that you'd want to bring them
and you can have compounded infections too, right? So like they could just get over one or be at the tail end of one and then get another one. And so that makes it really hard. It makes it so they're sick for a while.
Yeah. The average toddler, kind of young school-age children, toddlers, preschool-age children, on average will be infected by 10 respiratory infections in a year.
And that's usually packed into, like 6 to 8 months of the year.
So those tend to be concentrated into the winter. And so I've heard many parents come to me and say they're sick all the time, or they've been sick since November. And as we start to discuss it, what you tend to find out is that it's actually just up and down symptoms. So they had a lot of cough and runny nose 2 weeks ago, and then they seem to be getting better. And now they're back to coughing and runny nose again. So that's probably a sign that they were not fully recovered from the prior infection and have gotten another one.
Something else. Yeah. So the best way to prevent the spread of illness, hand washing, right?
Yes.
Yeah, you can't. It's funny because we were planning a surprise trip for my kids to Disneyland, and we were going to go at the end of January. And I mean, no one wants their kids to get sick at any time, but I especially didn't want them to get sick before we were supposed to go. So everywhere we'd go, I'd make my kids sanitize, and as soon as we walked in the door, everyone was washing their hands for 20 seconds and scrubbing. And my husband was like, you are going to make them drunk with sanitizer. And I'm like, I just don't want them to get sick. And they didn't. And so it's possible for other people in your household to be sick, but for everyone else to stay healthy, you just need to be vigilant.
Yes.
Hand washing, decontaminating frequently touched surfaces, just not sharing utensils, all that kind of stuff. It's easy because kids like to come up and grab your cup. And so, it's easy to share germs. You just need to be on top of it.
Yes.
But it's hard to.
Yeah. Patients ask me all the time, I bet you get sick all the time from being around all these sick patients. And it's amazing how sick I don't get.
Yeah.
Because every room I walk in, I sanitize my hands before I examine the patient. When I'm done, I sanitize my hands. Often I walk out of the room and I think, did I sanitize my hands? And I'll sanitize my hands again.
Do it again, just in case.
It's amazing how infrequently I get sick from my patients. My children, on the other hand, that's where I get sick. Because I'm not treating my children like my patients. Hold on 1 minute, before we play, let me hand sanitize.
Right.
And then once we're done, so it's amazing at how effective that simple measure can be. If any of the parents watching today have had a child that's been admitted to the hospital for something like RSV, you'll see it in the hospital, nurses will wear masks and these see-through yellow gowns and gloves, and those actually don't have near the effectiveness of hand washing. If all the nurses did was wash their hands and wash their stethoscopes after every patient encounter and before every patient encounter, that alone would do probably 99% of the infection control in a hospital.
And you assume, like you were saying at home, I mean, you assume your patients are sick. You don't assume your children are sick.
Yes. Yeah. Most of these illnesses, we've caught them 3 to 5 days before we even know we have them. And during that time, we're shedding virus. So that's why it's so hard to control a lot of this.
You don't even know someone's sick, and they're sharing it with the rest of the family and everyone, right?
Yep.
So we talked a lot about the cold. That's definitely probably at the top of my list of things I want to talk about. But a few other things that people want to know about are related to babies and sleep and crying. So let's cover those.
Yes.
Sleep training, first of all. When is it time to sleep train?
Well, the opinions vary.
They do.
They vary widely. And
I think it's important to say it's an opinion, because these things have been studied, but there's not like a hard line of when it's good and when it's not. Yeah.
And so what I have to say is what I often recommend to my patients, but just know that it's kind of my set of opinions. Like your pediatrician may have some different advice for you based on their knowledge of your circumstances. Yep. Yeah. And what I recommend tends to work fairly well. But like I say, there are lots of different versions. But what I tend to recommend is, usually I'm meeting parents. Oftentimes I'll meet them even before they have the baby. If not then 2 or 3 days after they've left the hospital. How do we get them to sleep through the night? Yeah, and so I start talking sleep then even. So there's an approach that people in France like to do. They call it the pause. And that is that once the baby has met their birth weight, because all babies will lose a little weight, once they've come back to birth weight, you can start introducing the so-called pause. And that is that when the baby in the middle of the night starts stirring, moms, especially moms, will, the second the baby starts stirring, they're up. And so what I recommend is that when you wake up because you've heard the baby stir, look at your clock. So if that's 2 a.m., then commit yourself to waiting until 2:10 or until 2:15, and make sure dad's on the same page. And you wait. And in that 10 to 15 minutes, the baby's going to start going from stirring to fussing, from fussing to crying, from crying to wailing. It's okay to let the baby cry during that amount of time. 10 to 15 minutes is not going to, actually crying for even longer than that is not going to hurt a baby. But it's okay to wait that amount of time. The reason that a lot of people kind of theorize this helps is that in 10 to 15 minutes, they're going to learn something that's going to soothe them. And they're going to realize that they're okay. And they might even realize it's not worth it to me to cry until mom comes. Expend all this energy. Yeah. And I'm just going to go back to sleep. So if they truly don't need anything, then they may just self-soothe. Yeah. And then after the 10 to 15 minutes, get up, feed the baby. After about, depending on the baby, this can take 2 to 3 weeks, or it can take maybe 6 weeks. The baby will quickly move into waking up to feed once or twice a night. And if you continue that pattern, even once they're feeding once or twice a night, instead of like every 2 hours. Yes. If you continue the pattern of pausing during that time, within 2 to 3 months, they'll be sleeping through the night. And babies can do that. They can handle sleeping through the night once they're a month or 2 old. The only thing we're worried about prior to that is blood glucose levels. The liver, we grown-ups, we will go, some of us can go a couple days without eating a thing. And our liver is taking fat and making glucose out of it. And sometimes our body will run on fat completely, ketones. And so what we're waiting for is the baby to be able to do that. And that can take, like I say, a couple months, actually less, but just to be safe, it can take a month or two.
And their growth trends and how well they've been thriving has something to do with it, if they were premature or not.
Yeah. And so, they're always...
That's why it's very circumstantial, and you should talk with your pediatrician. Yeah,
exactly. And so the pause that I recommend, it definitely, make sure your child is a good candidate for that, and the best way to do that is to chat with your pediatrician. And they will look at the growth charts with you, and if they say they're growing great,
they're just waking up at night and you're teaching them to wake up by feeding them, but they don't need to feed.
Yeah. We could, if we set an alarm every 2 hours and got up and ate, we would do the same thing. We would eventually not need our alarm. And
so just because they're waking doesn't mean they need it if they're old enough.
Yeah.
So what do you think about crying it out?
So the same thing. Huge spectrum. You hear people say there's 100 ways to skin a cat. Well, there's 100 ways to sleep train a baby. At the one end of the spectrum is the pure cry it out, where when you decide you want them to sleep through the night, you decide, I'm not going in there this whole night, and no matter how long they cry, I'm not going in there. If you look on the internet, you will find all kinds of opinions about that particular approach. Some people are very opinionated about that. They think that that's horrible. Why would you do that to a child? It sounds harsh, yeah. It sounds very harsh. But there's actually no evidence that that's a bad approach. At the other end of the spectrum is kind of this pause where you're giving them 10 to 15 minutes to cry, and then everything in between.
Yeah, I heard an interesting one the other day where the parents started out sleeping next to the crib of their baby, and then each night they rolled a little bit further away until they were out of the room. So they were present but moving out of the room rather than going in and gradually increasing the amount of time they waited before they checked on it. It was kind of like a reverse.
Yeah, that's interesting.
Yeah.
And I'm sure it works.
Yeah, it may be the right thing for some parents. And, I've said this before on Intermountain Moms, if you've tried one method and the baby's not responding, then try a different one, because maybe they just need something different.
Yes. The temperament of the baby is a large variable in all of this. And so all of these different sleep training techniques don't apply to every single baby.
Yeah.
Some babies cry a lot more. Some of them wake a lot more. Some of them are really easy to sleep train. Others are more difficult. I think just the one thing in all of this is it is important that you do sleep train your baby. 6 months is kind of the time when you want them sleeping through the night. And the reason it's important is because good sleep habits have so many very positive effects later on in life. And so if you feel that your child has been one that has been difficult to sleep train, it might be tempting to say, well, that's just them. I'll just go ahead and let them wake up even into toddlerhood. It's important, though, to try to not do that and to work on a good sleep habit.
And whatever you do, don't bring the baby into bed with you.
Yes.
Right? Yeah.
Yes.
I mean, we've all been up at night and it's been tempting, even though I know it's like the worst thing ever to do. But you're like, oh, if I just laid down with the baby, I know they go right to sleep, and then I would sleep. But you can't do that. You can't do that.
Yep.
Okay, so speaking of crying, a lot of people think that something is horribly wrong when their baby cries, but it's just their way of communicating.
Exactly.
And so you can expect them to cry. How many hours per day is normal for a baby to cry?
Well, it depends on their age. From the window from 3 weeks to 3 months, all babies cry more during that window of time.
So you may have gotten them home from the hospital and thought, oh, they're such good babies. And all of a sudden you're like, where did this baby come from?
Exactly. Yes. So all babies cry during that period of time. And prior to medicine catching up with what moms already knew, moms called it colic. And, in the 21st century, with all of the research that we've done, we still have no idea what colic is. There are some theories out there, and over the years, most moms have assumed that it is something to do with their GI tract,
Yeah, they're gassy, they're fussy, they're
uncomfortable. And so because of that, we see there's gas drops available. There's what's called gripe water. Gripe water has in it herbs, so fennel, which can be a smooth muscle relaxant, which smooth muscle lines all of the intestines. It has ginger in it, which can be kind of an anti-emetic or an anti-vomiting kind of herb. And in some babies, those measures work wonderfully. And when I say some babies, we're talking 20%. In more recent years, a lot of research has shown that probiotics can be helpful, especially in breastfed babies. And that can work wonders in another subset of babies. Another thought out there is that since all babies cry more during that period of time, that maybe it's not a problem with their GI tract. Maybe it's their brain. Maybe as their brain is developing, the brain always has a checks and balance system. It has a gas pedal and a brake pedal for pretty much anything that it does. And there's the thought that colic is the brake pedal hasn't caught up with the gas pedal. And so the brain is saying, let's cry like crazy for every little thing. And the brake pedal hasn't caught up yet and said, wait, we don't need to cry about every little thing. So it's just important for moms to remember and to know that from age 3 weeks to 3 months, it's normal for babies to cry. Some cry a lot more than others. If you fall into that category where your baby's crying a lot more than others, it can be... And
what is excessive crying?
Well, I think it's excessive if it bothers you as the parent. So if it's getting on your nerves, then it's excessive. And you can bring them into your pediatrician. There are some things, a good solid physical exam can rule out anything scary. But if your pediatrician looks at the baby and says everything's okay, it's okay to trust that.
That may leave some parents more frustrated because they were hoping for something that could be fixed.
Yes.
Yeah.
So if you're feeling really frustrated, recognize that in yourself and then take measures to decrease the frustration. Get out of the house, babysitters so that you can get a break. And it's okay to let the baby cry in their crib. The crib is a very safe place as long as you've made it a safe place by not having bumpers and stuffed animals in there. Put the baby in the crib, shut the door. It's okay to even put headphones in for 20 minutes and just take a break and let yourself chill out.
They could be safer in the crib than they are in the arms of a frustrated
parent. Yes. So it's okay to try some of those measures I mentioned before. It's okay to try the gripe water. It's okay to try gas drops, and it's okay to try a probiotic. The probiotic that everybody has studied is called lactobacillus. Some of the other probiotics might work just as well. We just know that lactobacillus is one that has worked. And that's what you'll find in Gerber makes a product called Soothe, and Mommy's Bliss makes a product as well. So those can definitely be tried. But if you've tried all those and it didn't help, then again, it's okay to let the baby cry.
One time, this was a good lesson for me because my son was normally a very good baby. He didn't cry a lot. But then on one particular evening, after I'd fed him, changed him, loved him, rocked him, swaddled him, soothed him, turned on music, everything that I knew how to do, he was still screaming at the top of his lungs. And then I started to get worried. What's wrong, And I'm like, okay, you're a nurse. You've got this. And you don't have to be a nurse to do this either. But I just had to tell myself that to have some confidence in myself. And I just you're just give him a head to toe assessment. So I was looking him over, taking his arms out, making sure nothing seemed awry or unusual. And then as soon as I took his feet out of his footy pajamas, he stopped crying. The second I did. And this is after an hour and a half of crying, and his feet were squished in his pajamas. It was that simple.
Yeah.
So it's not always something scary or, maybe there is something that you can do. My sister-in-law told me once that she found a little pin left over in the laundry in her kids' pajamas. And so, it's good to think of the most logical explanations first.
Yes. Yes.
Yeah,
Yep.
and to expect crying. And a parent will get used to their baby's cries and know, like, this cry means they're hungry.
Yes.
This one means they need to be changed. This one means they're tired and whiny, and it's okay to let them cry because I've addressed all their needs. With time, you get to learn that and you can accept it.
Yes. And there's one more thing that reminded me. A lot of doctors will say that the first 3 months of a baby's life is the 4th trimester. And so they would much rather be back home in the womb than out here in this cold, dry world. And
I like that.
So anything that you can do to remind the baby of home, the womb, can be extremely comforting to them. So in addition to the things I mentioned, whatever comfort measures you can do can go a long way. In fact, I would recommend those first before you try any kind of medicine. So when they were in the womb, they were often kind of tight. And so anything you can do to kind of make them feel kind of tight can help. That's where swaddling can come in.
And when should you stop swaddling them really quick? Because I get that question a lot.
So again, there's a lot of different opinions and recommendations out there. And even on whether or not to swaddle at all. So pretty much once they can roll, stop swaddling, just because you don't want them to roll over with their arms trapped and be unable to roll back over.
Compromised position.
Yeah, and so that's where you just worry about things like SIDS. So once they can roll, stop swaddling them. But up until then, you can go ahead and at least swaddle their upper body, and that's where those little swaddling blankets come in, because it'll keep their arms tight against their body. And the thought is there's that can help them feel at home.
Feel secure.
Yeah.
So what other things can you do besides swaddling? What other comfort measures are good?
So suckling. A pacifier. Any kind of pacifier that can kind of have kind of the can be safe for the upper jaw. You can use, and just sucking can be very comforting to them. They actually, babies, while they're in the womb, do a lot of sucking. In fact, babies sometimes will come out with little blisters on their fists because they've been sucking so much. So they definitely know how to suck. And so they find that very comforting. So suckling, swaddling, swinging motions.
We all naturally, when we pick up a baby, we all just start
everybody
to do
knows to do that.
Yeah.
It's part of our instinct, I think, as parents. And you find all those products that swing them side to side or front to back. I don't know that any one is better than the other. But whatever kind of swinging sensation that your baby tends to enjoy, then go for it. When they're not sleeping, you can go ahead and if you're holding them, you can hold them on their side. And sometimes other positions can be comforting too. Same thing, when they were in the womb, they weren't on their back.
Well,
they were head down, all over the place.
Yeah.
And when mom was sleeping, they were kind of on their side and things like that. And so all of those measures can be very comforting as well.
What about sound?
So, yes. So
it's kind of like the 4 S's, right?
Yes, exactly. Yeah. And so a white noise I recommend quite frequently. The womb was a noisy place, but a very comforting kind of noisy. The baby can hear mom's blood or heartbeat. The baby can hear the mom's blood whooshing through her aorta. And all of the fluid that the baby's floating in tended to make all of the outside sounds kind of just more muffled, and again, kind of a white noise kind of sound to them. So, so the white noise, I mean, a lot of parents will notice I start vacuuming and the baby stops crying. So it kind of has to be loudish, not so loud if it's too loud to you, it's too loud to them, but some parents kind of turn on the white noise machine and just barely turn it up so that the baby can barely hear it. Well, that's probably not enough. It needs to be loud enough to drown out background noise. If you can hear the neighbor's dog barking over it, turn it up a little bit more. If you can hear the cars passing out front, turn it up a little bit more. And they make white noise generators that are affordable, that can be picked up at any local store, and that can be very comforting as well. So
yeah, that is such good advice, especially for new parents. All of these things, sleeping, crying when they're sick, because you think that you're done worrying about them after they're born and they're out of you, but you have no idea. That anxiety just increases exponentially as you see them and see other things that they're going through. So all of this has been so helpful. Thank you so much, Dr. McBride, for being with us today.
Yes.
We appreciate it so much. And I know that all of this information has been helpful for you guys too. Of course, you know where to find me if you have more questions in the future, facebook.com/Intermountain Moms. Thanks everyone for joining us and have a great day.